This is Leo Pizzamenti. I have a patient with an evacuation report. We're currently located on top of Turkey Mountain with a 26-year-old patient with a 26-year-old female whose chief complaint is a left clavicle pain. The MOI is a fall down the tower stairs. The HPI is environmentally induced asthma attack symptoms that have not progressed to be anything substantial. The patient is currently LOR of A&O times 4. The patient exam reveals a left clavicle bruising and pain about the size of my thumb, as well as tightness in the chest while breathing. The time initially taken at 12:10 for vitals. We have the LOR of A&O times 4, HR of 64 with the quality described as strong and regular, the respiratory rate of 10 and is described as labored and slow. The skin is pink, warm, and dry. The blood pulse is adequate based on the strong radial pulse. The pupils are pleural and the temperature was not taken. We had a strong baseline trend when we did our vitals the second time. A pertinent sample history includes smoke from the environment causing tightness and coughing, which is relevant to their asthma attacks. They use an inhaler and multivitamins, and they've been managing this disorder since they're around 10 or 11. And then nothing was substantial in terms of their last intake or outtake leading up to the event. And then according to them, the patient was taking trips up and down the tower in an attempt to evacuate from the fire, and they had fallen down because they were kind of getting a little lightheaded. Let's go on to the assessment. Based on the MRI, there is a suspected possibility of a spine injury, although we conducted a FSA and had ruled that out for possibility. Additionally, we had a musculoskeletal injury sustained on the left clavicle and progression towards worse environmentally triggered asthma attacks, although we did not get to the attack yet. Our treatment plan set in place was to stabilize and immobilize the clavicle, and then monitor worsening of asthma symptoms and potentially be prepared to administer their inhaler. Our evacuation plan is to rapidly evac on the truck. The pain should not cause too much problems for the patient during evacuation. We don't really need any supplies as we are en route with everything we need. And then the only problems we might anticipate is worsening pain from the clavicle and potentially progression of the asthma attack, although things seem to be stabilizing. This is Leo Pizzamenti, out.